Hi everyone, Kellie Cassidy here, Clinical Psychologist and owner at Cassidy Psychology in Mount Pleasant and Canning Vale. I hope everyone's having a great Friday. You might see behind me here, I'm actually not at the office today. I'm at the office of another business called Wise Therapy. We actually work collaboratively with Wise Therapy, and I'm here today. I've just completed an autism assessment. So Wise Therapy work primarily with children with disabilities, but not only with that, but they're staffed by speech therapists, occupational therapists and physiotherapists, helping children who've got some developmental issues that they might be needing some assistance with. And I often get contracted in, one, to do autism assessments, but also to work on the psychological side, I guess, of difficulties children might be having with their development. So I thought I'd talk a little bit about autism today and how you go about doing an autism assessment and how psychologists can help with children who might be on the autism spectrum. So if you're not aware already, autism is a neurodevelopmental condition and it can affect behaviour, communication and also social functioning. And in terms of an assessment, it can be a bit of an involved process, usually starting with a developmental paediatrician and also involving a clinical psychologist such as myself and usually a speech pathologist as well, which is part of the reason why I was here. I was joining one of the speech pathologists to do an assessment today. Diagnosing autism isn't something that I treat lightly. I do a very thorough job of assessing to see whether a child might be on the autism spectrum, and that's really, really important to me. So our assessments involve interviews with parents, assessments with the young person themselves. That usually also involves conversations with school teachers, possibly even going out and doing observations of children at school or wherever they might be, to make sure that we really get that diagnosis right. And in doing so, we're looking for difficulties that children might be having with their social communication skills, how they relate to other people. We're looking for any repetitive behaviours, looking for sensory difficulties, a whole host of different things that are set out for us in terms of what we need to identify when we think or suspect that children might be on the autism spectrum. So that's what I've been up to this morning. And there's more of that process to come. I started with a family today. But I also wanted to talk about, well, if your child has been diagnosed with autism, how might a psychologist might be able to help in that situation? And it's not an easy answer to that. It kind of depends on the age or stage of your child, but there are lots of different things that we might be able to help with. So if children are having behavioural problems, we might be able to assist there. They've got difficulties regulating their emotions and finding that they're having lots of meltdowns and lots of tantrums and things, we can teach children skills with that and also give parents opportunities to do that. Children on the autism spectrum often experience a lot of anxiety, so we can work on giving them skills and tools to manage anxiety. Sleep is often a big problem with kids on the autism spectrum, so we can offer ideas and strategies to help with sleep. There might be skill development things like even toileting. Psychologists can help with if children haven't managed the capacity for toileting just yet. Then there's social skills and interpersonal skills that we can help children develop. We might also work on things like fears, phobias, eating, the whole range of different things, I guess, that all come under the umbrella of behaviour that a psychologist might be able to assist with when a child's on the autism spectrum. So it's certainly something at Cassidy Psychology that we offer to families. If you know of anyone who might be needing some psychological support with a child with autism, by all means send the referral our way. We'd love to help. We do get a lot of referrals from Wise Therapy as well in that regard. So yeah, it's certainly something that we can assist with. So that's probably all for me today. Enjoy the rest of your Friday and the weekend ahead. As always, here at Cassidy Psychology, we're working together with you to help you flourish and thrive. Bye for now, and I look forward to speaking to you again soon.